Respeto. Respect is, there are basically the basis of the Hispanic culture is family and respect. Respect is huge. And respect goes both sides. Because they do respect authority because they have the high power distance. And like I said, the healthcare professionals are considered an authority. So basically, they do respect automatically the healthcare providers. And if they don't respond to you, that doesn't mean necessarily, or if they not, that doesn't mean necessarily that they agree with you. They're doing it out of respect. And because they don't want confrontation. Because it's the personalismo, because they need to be, they respect you, they respect your knowledge, but they don't necessarily agree with you. So most of the time, silence actually means disagreement and not agreement. So we need to be very careful with that. You know, we need to be careful about their body language, and we're going to go through body language and communication. Eye contact. Some will keep an eye contact, and some will not keep an eye contact because it's a humble culture, and they will not, out of respect, they will feel it's rude if they keep a direct gaze or an eye contact with you, especially if it's someone from a different gender. Especially if it's someone, so if you are a male handling a female, ask her if she wants to have a female present with you. So this is big, anyhow, respect. And when you call a person, a Hispanic person or a Latino person, make sure to call them Mr. or Mrs., like senor or senora. And you know what? It doesn't hurt anyone to know few words in Spanish, especially if most of the people that you see are Hispanic. So senor, senora, buenos dias, buenas tardes, you know, ¿cómo estás? Hola. You know, just few words. And believe it or not, these few words will make people feel that you're warm towards them, that you care about them to the point that you actually learn few words that will attract them to you. So, and that's the base of confianza, which is the confidence. You will gain their confidence from the get-go. And I know that we're having less and less time as healthcare providers to give to the people. But if you don't spend a little bit of time, the 15-minute cookie cutter that most of the healthcare, especially doctors that rotate around, have these days, will not cut it with the Hispanics. They will not follow the treatment, they will not come back, they will not really believe in the treatment. And I know that some will tell me, well, it's their loss. Yes, it's their loss, but you know what? If you are healthcare providers, you are in this profession because you want to help people. You know, like we say, if the mountain doesn't go to Muhammad, Muhammad goes to the mountain, something like that. There is a saying that, you know what, we care. We healthcare professionals care, and that's why we are in this profession. So there is a generational hierarchy. So the grandparents are the most respected people in the family. And then it goes, especially age. Automatically, people that have power, people that have status, people that have money, people that are older, gain respect instantly. They don't have to do anything, they don't have to show anything, they gain it instantly. So when you call a person or tell him senor, and you call him by his last name, not his first name. First name is an informality that sometimes they can consider rude. So it's always important to give that respect, because they will call you senor or senora or doctor or doctora, you know, they will call you by your title out of respect. So respect is both ways. Taking care of the other, like I said, hospice is basically orphanage, so we need to be careful of that. Just a funny story, how people translate words in different ways. There is a brand of pens called Parker. And they have, I don't know, it's not very well known here in the United States, but in Europe they are big. They are like, not a Mont Blanc, but it's just like a little bit less than a Mont Blanc. And they had a marketing campaign that it said it will not leak in your pocket and embarrass you. And they wanted to go to the Hispanic market, and their marketing gurus translated that, and instead of embarrass, they used the word embarazar. And embarazar in Spanish means getting pregnant. So basically the word was like, it will not leak in your pocket and make you pregnant. So people sometimes, you know, translate words not knowing that they don't translate at the same meaning. So cultural sensitivity. So respect, to get it, you must give it. And power distance, like I said, call them señor and señora and by their last name. And by the way, Spanish is a language like French. There is a word for, in English we say you, and you is male, female, older, younger, but in Spanish there is a difference. Usted is the more respectful term to use. Tú is when you talk to someone that is a friend or someone that is close to you, but out of respect, everybody is usted. Usted is the proper word to use. Unfortunately, there is nothing that I can compare to in English, but it's the same in French. In French, we say vous, like usted, toi, like tu, or tu, like for two. So there is a difference even in respect in the word in the Spanish language, different between the term that you call someone with respect or in a friendlier way. And now, the individualism. Like we said, individualism is not really looked at in a very great way in the Hispanic community. So it's about family, it's about groups that take precedence about everybody else. There is no competition, but there is always cooperation between the families. Personalismo is important. Personalismo means that you have to build a relationship with these people before actually starting dealing with them, before they trust you, before they listen to you, before anything. You have to build that relationship. And when we come to communication, I'm going to give you a few tips on how to start building that. But personalismo, respeto, these are important parts of the Hispanic culture. And then there is simpatia. Simpatia is being kind, is having a smile on your face that is not over-exaggerated, not the icy high, but just actually a genuine smile from the heart. So they feel that you actually care about them as a person. Because they especially when someone comes as healthcare provider, they will come to you because they are vulnerable or because they need help. So they are in a very vulnerable position. So we need to show them kindness and we need to show them that we really care about them. And that's what's called simpatia.